Okay, so just to give you a brief overview of the funding call itself. So we have a total of £100,000 available for this call. And we anticipate that any one project would be funded in the region of £10,000 to £30,000. So £30,000 would be the maximum award that we would expect to give to any one project. So we might be funding between 5 and 10 projects in total. It's a requirement of the funding call that project teams must be transdisciplinary in nature. So that means we want you to be pulling together a range of experts from different disciplines and sectors, so that the teams really bring together people with different experiences that are relevant to young people's mental health. And young people, of course, should be part of those transdisciplinary teams. In terms of timeframes, there's no set start date, and projects can be up to 18 months in timeframe, but they could be shorter than that. But they must all be completed by June 2022. So that's the fixed end date for projects. But the start date is flexible, particularly given the current circumstances. So we will have, as part of the Triumph team, a research assistant based at the unit in Glasgow, who is available to provide support to projects. So for any one project, up to 50 days of research assistance time will be available to support delivery of that project. And we'll tell you more about all of these details later. As I said, young people should be involved in the development and delivery of the project. So you'll hear a bit more about what we mean by that in a minute or two. And by young people, we mean those aged 10 to 24 years. And the deadline for applications is the 31st of July this year. So let me just tell you briefly a little bit about the scope of the funding call. So Triumph is about promoting youth public mental health. So by that we mean promoting good mental health and well-being and preventing mental illness through enhancing our understanding of influences at the society level, at an organisational level, at a community level, and at the individual level. And Triumph is very much underpinned by a social ecological model, which you can see here on the right-hand side of the slide, where the individual is at the heart, but their health and well-being is very much influenced by factors at different levels beyond the individual. So we're interested in relationships, for example, at the social and community level. We're interested in the settings in which young people live their lives. And we're interested in wider societal factors which might impact on young people. So these should all be reflected within the projects that we fund. As I said, the target age range is young people aged 10 to 24 years, so both those in school and out of school. And within Triumph, we have 3 key network themes. The first one is social connections and relationships. The second one is schools and educational settings. And the third one is key groups. And at the moment, we've very much focused our attention around 2 key groups, which is LGBTQ+ young people and also care experienced young people. But we're not limiting this funding call just to those 2 groups. So if you're working with other key groups of young people who may have particular issues around mental health and wellbeing, then we'd be delighted to hear from you too. So further information on all of those themes are available on the Triumph website and in the funding call documents that you should hopefully have had a chance to look at already. Now, over the last 6 months, we've been through quite an intensive process within Triumph to identify key priority areas for research and for this funding call in particular. So we've held a number of agenda setting workshops and worked in collaboration with various partners and stakeholders, including young people, practitioners, researchers and policymakers, to really identify what we feel as a group are the key priority areas for moving forward around youth public mental health. So here we have a list of some of the key cross-cutting themes that have arisen from that process, and this very much kind of outlines the scope of projects that we will be looking to fund. So for example, projects that would address how we build relationships that support good mental health and well-being amongst young people. How we can use whole system approaches to support young people's mental health. How we can use social media to improve mental health. And obviously that's an area where there's a lot of work being done at the moment, but a lot more that we need to understand. How we can support young people at times of transition, and that might be educational transitions or work transitions or care transitions. We're interested in looking at improving links between different services and settings to improve the support that's available to young people. There's a need for development and training for those who support young people's mental health. And there's also a need to look at staff mental health and well-being, so particularly within a school setting, for example, but also in other settings such as youth work. We're interested in looking at how we can engage better with families to support young people. And we're also interested in how to better understand young people's level of awareness, their access to and experience of services. There's also interest around representations of identities and relationships in popular culture and how that interacts with mental health and well-being. And beyond the school setting, we're interested in out-of-school community settings that support mental health and well-being as well. So those are some of the cross-cutting themes that really cut across the three core themes within Triumph that you can see along the top of that slide. But further detail is available within the documentation that you'll find online. And specific to each of our Triumph themes as well, you'll find more information there. So we will be looking to fund a range of different projects. So research projects could include areas where there's an existing mental health intervention, which is looking to scale up or to be translated into a different type of setting or with a different age group, for example. You may be interested in doing some evaluation work around an existing mental health intervention, but you don't really know where to start. So you want to do some initial work to look at potential for research and evaluation. It may be that you're ready to go ahead and evaluate, that you haven't been able to do that yet, but this funding could provide an opportunity for you to look at, build an evidence base around an existing mental health intervention. We will also be supporting scoping work to support development of new interventions, which specifically support young people's mental health and well-being. And we're also looking to fund opportunities to embed co-production approaches with young people into new or existing mental health interventions. So that's the broad scope, but underpinning all of that is really we're looking for research projects which have the potential to demonstrate a pathway to impact for longer term scale up and development in the future. So we don't want to fund projects which are standalone and don't have the opportunity to be sustained in the longer term. We can say more about that if you've got any questions around that. Out of scope projects, we're not looking at provision of services themselves, and by services we're talking about treatment or clinical care for diagnosed mental health conditions. So our focus is very much around prevention and early intervention and promoting good mental health and well-being. We're also not going to be funding basic research which is not linked to intervention, development or evaluation. So the scope of Triumph is very much around programmes or interventions to support mental health and well-being amongst young people.